Good morning, and thank you for joining me on today's call on how to manage supply chains through effective outsourcing. My name is Nicholas Markel, and I'm an Executive Director with NSF International in the Pharma Biotech Division. Before we get started, let me cover a few logistical items. This webinar will be recorded, and you'll receive a link to the recording after the webinar. Feel free to submit any questions you may have during the presentation using the chat window in the lower left hand of your screen. We will have time at the end of the presentation to address some of these questions. So with that, let's dive into today's topic. A quick background on myself. My career started in 1990. This included time with top biotech companies as well as startups. During my time in industry, I held several senior management roles in operations. And starting in 2006, I began consulting where I really developed my quality systems expertise. I've always been a person who approached my work, regardless of whether I'm in operations or quality, with a good quality mindset. In other words, do what's right, not just the minimally required thing to do. I find this approach just makes good business sense at the end of the day. During my time in industry, I used outsourcing. And during my time as a consultant, I've worked with clients in the outsourcing field, for example, contract manufacturing operations. And I like to believe that I've developed a pretty balanced outlook on the relationship as a result. I am happy to be with you today, and I look forward to sharing my thoughts with you on supplier management, specifically as it relates to outsourcing. A quick review of the agenda. We'll cover the basic steps associated with the supplier lifecycle, including your supplier selection, supplier management, the mistakes we all make. I've made every single one of these. They're very easy to make. And then we'll wrap it up with an opportunity for questions and answers, as mentioned earlier. Please note that for the purposes of this webinar, the term supplier should be understood as the supplier of an outsourced operation, such as a contract manufacturing organization, contract testing organization, contract research organization, and so on. A few words on the supplier lifecycle. To put things in context, the supplier lifecycle, just like products, validation, and even people, all have a beginning, likely some awkward teenage years, maturation into adulthood, and finally an end. And as such, we need to plan and manage accordingly. This graphic just simply illustrates the major steps of the supplier lifecycle and emphasizes the need for continuous active management and planning. Okay, so let's talk about selecting your supplier. As with most things today, it's encouraged that you take on this task, taking into consideration risk. We'll circle back to risk in a minute. Additionally, it is critical that you ask questions and take your time doing your due diligence. As tempting as it might be to take shortcuts or disconnect even throughout the process, you must stay actively involved to maximize the chances for success. The process can indeed be onerous, frustrating, nerve-wracking, and take a long time if you let it. I hope to give you some tips to prevent at least some of these things from happening. All right, let's talk briefly about risk in the context of supplier selection. I am not going to talk to you about how to evaluate risk. Rather, I want to talk briefly about the fact that depending on your needs, your selection criteria may be different. For example, the value of the questionnaire may take on a higher or lower priority. The level of effort, the number of, quote, exceptions you might be able to live with, and so on. All these things may vary. I've listed here on this slide only a few of the risk factors to consider. For example, what type of operation is being outsourced? Is it production? Is it packaging? Is it with a CMO? Is it with a CTO? Is it with a CRO? If you're outsourcing production, what product stage or stages? API, finished dosage, both? Is it clinical or commercial? What dosage forms? And so on. Continuing supplier selection in the context of risk, it's important to understand why you are outsourcing. Are you caught in a pinch? Did your existing CMO get caught up in a regulatory problem? Or is your own facility having problems? I know personally in my career, I've had to outsource due to contamination issues in my facility. Is outsourcing a new thing, or is it just a routine way of life for you and your company? Do you maybe lack the technical expertise or facilities, and that's why you're outsourcing? Also evaluate for how long you'll be outsourcing. Permanent, temporary? Are you just doing a clinical batch or two to start, and then you need to wait and see? Do you need your supplier to do some development work, or is it just a straight up transfer and routine manufacturing? Okay, so at this point, you've done a lot of the background work. You know what you need. You know why you need it. You understand your relative risks and so on. Now it's time to make a list of organizations that may fit your needs. My suggested approach is really not that sophisticated. I rely primarily on, in priority order, the following. First, trusted contacts. Then internet research. And finally, only if needed, use a consultant to help you. If you're anything like me, at this point, your list may be a mile long. You might have one source that says, oh my goodness, company X is fantastic. And then another one that says, whatever you do, stay away from company X at all costs. This, of course, is no different from reading reviews online, right? I'm that guy that will obsess on the one negative review in a sea of positive reviews. I urge you, don't be me in this context. Regardless, it wouldn't be a surprise if you end up with too many choices and then you start to wonder where to turn. You've made your list, now let's check it twice. It's critical that your list be manageable. Now, I can't tell you what that means for you. For me personally, it means making some very hard decisions and not exceeding 5 or maybe 7 candidates in exceptional cases. I think that 3 or 4 is ideal. To really help weed your list down, I encourage you to look back at your risk assessment and really be ruthless with highlighting your must-haves. I also suggest developing a user requirements specification, a URS. I know that many people may view these as being for equipment only. However, the concept of a URS is valuable and can be applied to anything you are buying. Just remember to make sure your URS is in line with the risk level identified in your risk assessment. Now, at the risk of dating myself, I also suggest that you might be wise to pick up the phone and have an initial conversation with suppliers you're considering. Are they receptive? Are they open to talking? Are they responsive? I realize this might sound contradictory to some of you. I'm up here encouraging a rigid, systems-based, data-driven approach. I'm using words like be ruthless. And now I'm suggesting you reach out and talk to folks? Well, it's not that crazy if you think about it. At the core of any system or process are humans. And as such, I really think you should not overlook what I call the human factor. It just makes sense to get a feel for who you are considering partnering with, doesn't it? It's far from perfect, I realize, but I believe that most of us will quickly sense a good person when we interact with them. Odds are a good person will translate to a good organization. All right, so by now you've whittled your list down to your top options, and it's time to decide who's naughty or nice. At this point, you should develop a request for proposal, an RFP. Luckily, you've done most of the work already by putting in a lot of thought in developing your risk assessment and your URS. So after you send out your RFP, I highly encourage you to do the following. First, ask all recipients to confirm receipt. Make sure that the file didn't get hung up somewhere. It's really disappointing if you discount a potential candidate because they didn't reply, only to find out they didn't receive the RFP to begin with. Ask for case studies, or better yet, a reference or two you can call. Allow time for questions. Believe me, now, no matter how hard you worked at writing the perfect RFP, where you've anticipated every scenario and you've left no room for questions, you didn't. There are always questions, and often very good ones, that help make the selection process even better. There's a few ways to do this. My personal favorite is to hold a single teleconference with all candidates, make it anonymous, of course, and allow everybody to ask their questions. It's a very noble thing to do, as all candidates can hear all questions and answers, and it helps to make the process as equal or as democratic as it can be. You can also simply give all candidates a date by which they can submit questions electronically. Remember, anything submitted late will not be answered. Either approach will work just fine. Finally, make sure that all suppliers are crystal clear on the timeline by which all responses to your RFP must be delivered. Candidates will get increasingly creative with reasons why they did not respond in time, but this is one point where you need to be very strict and stick to your guns. So at this point, you'll have a lot of information coming at you, so it's really important you have a system in place to manage all of this information and all of these responses. Try to keep it as simple as possible. The ideal goal here is to be able to compare apples to apples. It's harder than it looks. Sometimes it might even be impossible, might not even always be necessary, but that's what we all try to do. Remember, all suppliers will have a certain level of commonality, but then all will have their differentiators, which makes that apples to apples comparison a bit difficult. A simple system I use is a table where you list out all of the criteria along the left-hand side, and then you have answers in the various columns corresponding to the suppliers next to it. So the final step in the supplier selection process, schedule some site visit or visits. Deciding who to visit should be based on the full body of knowledge gathered up to this point. I mean, you need to take into account all factors, including your RFP responses, conversations you may have had, any referrals you've had a chance to talk to. And of course, prior to a site visit, you should submit and receive a quality questionnaire. Again, just be careful. Don't put too much weight on any single data point. This includes the site visit. Scheduling the site visits can be difficult. How long will they give you? Maybe 1 day, maybe 2 days if you're lucky. Who needs to attend from your side? Remember, access to information can be challenging at a contract organization due to confidentiality and the fact that you don't have a contract in place yet. But these are all individual bits of information that need to be looked at collectively before you make your final decision. Okay, supplier management. Congratulations, you've selected your supplier. Now it's time to get to work. So obviously you need to put a contract in place as well as a quality agreement. I would think it would be self-evident in 2018, but believe it or not, I still work with clients that have been working with contract organizations without a quality agreement. It seems some people think it's just too hard. I find that it becomes easier if you view a quality agreement simply as a list of who has responsibility for what. In fact, don't even think of it as a quality agreement. Think of it more of a GBSCA. That's a good business and common sense agreement. Also, by definition, don't forget you will have some sort of technology to transfer, be it a process or methods or likely both. Please do not minimize this very critical task. This is the first task in this new relationship, and probably nothing derails or sours that new relationship quicker than poor tech transfer expectations. This is usually because you, the client, thinks it will happen overnight, and the other guy, the supplier, wants an excessively long time frame to accomplish this task. I've been on both sides of this relationship. I understand the need to have it happen quickly. I understand the need to want to have it last a little longer. The truth is probably somewhere in the middle. With some good conversation, good listening skills, you'll probably be able to come up with a good compromise. A trick I use to help drive this is to actually put a protocol in place so there can be agreement on what constitutes a successful transfer. So continuing on to the more routine aspects of supplier management. Think about if you need a person in plant, particularly for a CMO. Please think about this early and put it into your quality agreement. I often see this point, whether a person or plant will be allowed or not, only be addressed when there's a problem, and now you need to negotiate this when stress level is high. It's not a comfortable place to be. What sort of scorecards will you use? Again, I urge some more common sense here. As another common bone of contention is the disconnect between the level of detail and quantity of KPIs to be generated. Many people, i.e. the clients, want to know everything rather than just focusing on the critical few, while the supplier will likely want to minimize the KPIs. Plus, layer in the fact that you need to not only balance quality metrics, but also financial metrics, and it quickly can get complicated and overwhelm you if you're not careful. It's also common at this point to focus on day-to-day tactical execution. Don't get me wrong, this is absolutely critical and must happen. However, it's very important to periodically breathe, step back, and have strategic overview, business review type meetings. Finally, don't forget routine items like surveillance audits and updating of quality agreements also need to be addressed. Okay, so we've talked through supplier selection and supplier management. Now let's talk about some common mistakes that can and frankly usually do happen during both of these steps. First, let's talk about common mistakes that happen during the selection process. I'm going to bucket these into two basic categories. Category one, I'll call too nice. Mistake number one is too many candidates. You just haven't whittled down your list that we talked about at the beginning. You allow that RFP process to drag out. You don't want to hurt anybody's feelings, perhaps. You don't check references. You don't do your site visits. You have too many internal people involved, and you're trying to please everybody at your organization. To this I ask, has nobody with kids ever tried to satisfy everybody at dinner time? Mac and cheese for you, pizza for you, and chicken fingers for you. Okay, it's a silly analogy, but hopefully you get my point. The second category is you're not nice enough. You overlook that human factor I talked about. You're too rigid, you're too dogmatic, you think you have all the answers. It has to be done your way or the highway. Please remember, these folks are in business because of certain expertise and core competencies that they have that you may not have. So therefore, I really believe it's wise to listen to options and be flexible where you can. Finally, over-reliance on a single piece of data, such as maybe your questionnaire or your site visit. Again, it's a totality of all of the information that you really need to actively select the right supplier. A tool I like to use to help me avoid some of these is simply have a process and follow it. Don't stray from that process too much. Now let's talk about supplier management common mistakes. My experience is that most of the mistakes that happen in the supplier management phase are made due to what I call extreme thinking. In other words, a lack of balance. Some examples of extreme thinking are you're too vague or you're too overly specific in your expectations. You're too involved or you're not involved enough. These may often come out during that tech transfer phase. You have too many cooks in the kitchen. Consider implementing a RACI, a responsibility, accountability, consulting, and informing chart. If you do use a RACI, and it's a good tool, don't forget you should also evaluate your RACI itself for balance. For example, a RACI does nobody any good if everybody is responsible and nobody is accountable. You're too tactical. There's no big picture thinking. And again, you have too many or too few KPIs. A few simple tools that might help you avoid some of these common mistakes. View your supplier as a partner. They're not your enemy. You need each other. You should listen and remain open. Routinely review and update your quality agreement. Nobody writes a perfect quality agreement, and updating is a great opportunity to make incremental improvements over time. Really consider the use of a protocol for tech transfer with clearly stated and agreed upon acceptance criteria. So clearly, neither list that I presented of common mistakes can be considered all-inclusive, so I'm going to offer all of you some bonus points if you get back to me with a wildly new and original mistake that you've made outside of these ones. So let's talk about the 5 keys to success. These are deceptively simple. They're simple words, in some cases short phrases on the screen in front of you. I fully acknowledge they're easy to say and they are hard to do. They're full of nuance and challenges, every single one of them. So the first one, probably to nobody's surprise, is balance. Second one is partnership. Again, it's you and your supplier. It's not you against the supplier. During the supplier life cycle, I talked about the need for active management throughout this entire process. Active management is not something that should be a part-time job. You need the dedicated people and the right people to do that process. You need to listen and listen a lot. And finally, you need to plan some more, and keep on planning. An old mentor told me, it's time to get planning religion, Nicholas. And guess what? He was right. Okay, so thank you for attending. I see we do have a few questions that have been submitted to the chat window. Let me take a second and scroll through them. Okay, the first one here, someone is asking if it is ever okay to skip the questionnaire or site visit. They're basically challenging me on one hand, I'm encouraging have a process and stick to it. And on the other hand, I'm saying use risk and evaluate. So what do I need to do? Do I need to stick to the process, or can I mold the process to what I need to be? So of course my answer is if needed, depending on that risk. If it's an absolute critical regulatory issue, you probably don't want to skip any of the steps in the process. If this is a early stage clinical, you have some time, you don't quite know what the future of the product or process is going to be, maybe you could consider skipping one of the steps in the process, for example, the questionnaire or the site visit, and rely on some good referrals. Okay, the second question, somebody wants to understand what sort of risk assessment should be used. Do they need to use an FMEA? What is the relative power number that they should be using for deciding whether to do the whole process or skip a step? Again, this was not intended to give you a detailed process on how to do a risk assessment. I am merely encouraging you to consider the fact that what you are doing and why you're doing it and for how long you'll be doing it should play a part in your decisions and the directions and your area of focus. I hope that helps a little bit. Okay, unfortunately, it looks like we've run out of time. If we did not get to your questions, I promise we will follow up individually. Thank you again sincerely for attending today's webinar. The contact information is listed on the screen in front of you there. Please do not hesitate to reach out to us if you have further questions. All of us are approachable. We're responsive. We're not going to give you the hard sell. We're here to help. Look forward to seeing everyone on future NSF webinars. Hope you have a great day.